Good morning, everybody. It's Tuesday. What the hell day am I on? 10, 11? Anyway, yeah, we had torrential downpour last night, and yeah, they put out our times to go into work, and they gave me off, and I'm like, what's happening? He's like, oh, everybody is going to be off. Watch. He said it's pretty bad what we got going on. So anyway, I'm trying to figure out. This goes to the one my mother had for her knee replacement. It's that freezing water, freezing cold water, um, circulation pump thing for the knee, and I'm trying to decide how I want to position this. I had it on here the other day. I'm trying to get the swelling around my knee and my quad, because my quad is really bad. I think the quad muscle is just, yeah. Anyway, so I'm trying to want to get this on here and sit here and gab at you while I freeze my leg off. I haven't had surgery yet. It's a couple weeks. God, they ask so many damn questions. They did like a pre-thing, and I'm like, they're like, medications you take and anything over the counter. It's like you should have had a separate designation for the over the counter stuff. Because, yeah, I don't have any prescribed junk. 90% of the time, if I can, I will do a pharmaceutical if it's absolutely, detrimental to my health. Or to, resolve an issue pre-op or something like that. Like, I think my GYN doc, she's awesome. I love her. She is a great doctor. I mean, now, I don't have a whole lot of faith in doctors, but there's a select few that, yeah, they actually are really good, and they're thorough, and they're not assholes, and they're not judgmental, and they don't, judge the book by its cover, right? So her and I had a follow-up. I had a follow-up appointment with her after I had a cancer screening surgery. She literally had to put me in the OR because we couldn't do the procedure in the clinic like awake. She had to be kind of aggressive, so she was like, I can't do this and have you be awake. So we're gonna schedule you to be, you're gonna need someone to drive you and that whole 9 yards. And I was like, yeah, got it, totally understand. So, and she even had a problem with that too. Because yeah, anyway, my anatomy is kind of fucked up. And so so anyway, and it's not unusual for people to have fucked up, anatomy. Where's the plug? There you are. Let's get you going. Might not be real cold yet. I just changed out the water bottles, the ice bottles in this thing. It's awesome. I love this thing. So anyway, my mother had knee replacement surgery, and she brought this to me when I injured mine, and I try to use it at least once a day. Sometimes I get busy with other stuff and it just doesn't happen. But right now, the knee hasn't been operated on. It's just I'm trying to get the swelling around the injury site in itself to calm down. And the swelling, I think, is pinching off a lot of the nerves and the mobility and the muscle, communication with my brain type of thing with the quad muscle. And there's a tons of videos out there where the physical, I can't remember what it's called, but it's a physical therapy type of thing. And they give you kind of insights and information on ACL injuries and the way the body kind of responds. And yeah, that's what I'm dealing with. I got a quad muscle that just doesn't want to cooperate. I try to flex it, and it looks at me as like, and don't do nothing. I'm like, it's not flexing. Why? So anyway, my rant today, as I've gone through my, prologue. Hi, everybody, if you've been here before. And if you enjoy my bitching and my complaining and my weird facial expressions and, you know, everything that goes on in my life, you know. Anyway, I got a phone call yesterday and I'd had this appointment. I knew about it, but I hadn't taken the time off yet, right? Because I didn't know what the fucking appointment was. I had called up back in the beginning before this injury and got a list of all the appointments through the VA, what days and times, right? And there was one in there and I was like, what is that, right? I don't recall putting that in there, right? So here's the fucked up part. Now, I might have done it, but I didn't know what I was doing it for. Okay? This is where it gets weird. VA has a GYN, and I have a GYN in the VA that I don't need a referral for. I can call there and be like, hey, can we do my annual PAP? And get it done. Why is this PC wanting to look at my hoo-hoo? So, that's what the appointment was. I was like, I didn't authorize her to be fucking digging around down there. I have a GYN. I can go to her. I can call her. I'm going to call her today. I'm going to find out, and I'm going to call my management and be like, recoup that, take that shit off. No, I am not doing that appointment. 1, I don't like my PC. 2, I can't stand her, actually. It's like, I don't ever want to, I don't want her touching me. To be honest. Just putting it out there. And so when I get done with this video, I'm probably going to get on the horn and be canceling that appointment and calling up the other facility that I have a direct phone number for and scheduling this once I can bend my knee kind of thing. Yeah, I'm just so frustrated with the VA system in itself because this PC really, I mean, I have a GYN. It's not like we're short of docs. I had a GYN before. Well, they were a little short-staffed, so they put me out on the market, you know, the civilian side of things, to get seen there, and I didn't like him. So when they called me after, I was like, I ain't coming back to this guy. He's weird, right? And he said some things that I was like, you fucker, I have no clue. Okay? I don't know if I did a video on this. I might have and just never uploaded it or deleted it, whatever. But he had told me that once I am in menopause, that once, you know, I stop having, you know, cycles every month, that there is no chance whatsoever of getting pregnant. And that is absolutely, positively fucking false. Let me tell you a story. I went to high school with a girl whose oldest brother was the same age as my mother, which put this woman who gave birth to her like at the age of like 56 or 57. Yeah. I'm sitting there like, and he's telling me this. And I went to school with a girl whose mother got pregnant after she stopped cycling. Now, is it rare? Yeah. Does it happen? Yeah. Does it happen a lot? Maybe not. But the risk is still there. Okay? I was like, this guy, oh my God, did he not? Anywho, so I was talking to my GYN and I had told her what this man had said, and she was just like shaking her head. She's like, that, good call. Good call, girl. I was like, yeah, we don't need you. You know, that kind of ignorance, that kind of incompetence is exactly the shit that I look for coming out of a practitioner's mouth that tells me their level of competency. It's that shit, right? So it was like, I can't even, I had just gotten like a phone call and they're like, yeah, I have to check my schedule or whatever. And it was like immediately after, here's that the clinic where the GYN is actually assigned to. They call me and they're like, yeah, we got a new GYN, blah, blah, blah. Do you want to come in? I was like, fuck yes. So we skip the whole PAP thing. They do the same type of testing, but it's not listed in the record as a PAP. She did everything that, but she also did, she tried to do the screening clinically and it wasn't going to work. So that's why I ended up in surgery with her, like the OR, in order for her to be a little aggressive, in order to get this cancer screening and to look for like fibroids and, things like that, because women go through that when they still have all their stuff and they go through menopause naturally. There's weird little things that can occur, right? So that's what she was looking for. And she was having a hard time doing it in the clinic. So here we are. So I get a phone call yesterday from the nurse over here at this fucked up clinic where I'm at. And she's like, oh, we have just confirming your appointment for the 20th. And I'm sitting there like, I don't even know what this is for. Is it a follow-up? What is it for? Oh, it's for a PAP. And I'm like, I don't even like this woman. Why is she papping me? I got a GYN. Why am I can call the GYN. I can get in down there. I don't need this woman putting me on her books without me knowing exactly what it is I'm getting fucking seen for. When I got this appointment, I seriously thought it was just a follow-up to the other appointment that I had like 3 months ago. Not even 2 months, like a month and a half ago, right? Because I had asked her to put in blood work for me, and she never did. I asked her to do the whole endocrine panel. She wouldn't do it. So I was mad. Like, I got calcium in my blood, from my blood work, and a very little bit of blood work that she did do, and you didn't address it. It's high. Why is it high? I've never had high, right? So I'm like, maybe I need to do like an endocrine panel. This is before I even got on the fucking video with her. I'm looking at my blood work, and I'm looking at things that I'm concerned about. She didn't even blink an eye. Now, I had back pain when I'd originally seen her in November, about 2 days after I decided to, like, this is retarded. Why am I drinking so much? This is stupid, And then I got the epiphany and I did that video. And the epiphany was, here, I am doing this to mask my pain. Now, there probably a tie-in video to this, because I had to explain that this man had me so nerve-wracked the entire time I was with him, and the only reason I was sticking around was because of the kid, kind of thing, that it was a requirement to keep my sanity, to drink something, to settle my fucking nerves as soon as I got around him. There was no peace in my bones. So, the entire 15 months I was with him, I was basically drinking in order to calm my fucking nerves, because I was in a state of, like, 24/7 anxiety and permanent hypervigilance and living on adrenaline to keep my sanity. It was a rough ride, let me tell you. So anyway, when I left him, all of the abuse, I was masking that with alcohol too, right? So I just kind of like, one day I'm like, why am I doing this? It's like almost like instantly when I questioned it, I lost the taste for it. And then it got me on this thought, what if? What I just rationally looked at within myself, what if this is the reason why everybody else is addicted? Or, what if it's a self-medicating thing as opposed to a physical addiction? Well, alcoholism does turn into a physical addiction. Alcohol turns into a very dangerous physical addiction. And I knew better, right? Which is the conscientious choice of, this is stupid. Why am I putting myself through this? Now, I tried yesterday, do 4 videos of the timeline to try to tell the stories again, I will not be able to tell those stories in the most intricate and detailed fashion that I had when I originally told them under, like, half intoxicated. I can't do it now sober. I can't. It's like I can't even. I get turned around and upside down and forget, like, very specific, pertinent details, kind of thing. Yeah, I totally just. Anywho, shit, I was forgetting pertinent details in the drunken one, but the drunken ones actually were, a little bit better stated. Anywho, so freezing my leg off, talking about this crazy VA system. Now, after I get done with this, I'm going to be ending up calling patient advocacy and being like, you know what, I don't have no faith in this doctor, and you just need to find me another one. I'm not even going to give you the reasons why. I don't care. I don't like her. Now, you can't find me another doctor. I'll go get the one that I used to see on the civilian side of things, and we'll just, because I can't stand her. It's just, I have no faith in this woman. I get a bad fucking vibe every time. So, there's that. Anyway, and I will be calling the other clinic, and I don't care when I get that, it's going to get done probably after this surgery is done. So I'm going to have to wait until I get my mobility back to hang out in the stirrups. Yeah. Considering that I've been celibate for like going on 2 years now, I don't think it's not a big rush. And she did, that surgery like last year. So it's like, why is this woman rushing this? Right? She's not going to do the blood work to do any kind of hormone level. What the hell does she want to look at my hoo-hoo for? Strange. Yeah, I think it's more effort to put me in the stirrups and dig around up there than it would be to click on a computer. Submit. Me, walk down the hall, get jabbed, drawn, go home. Stay dressed. Psychotic. I'd rather drive 50 miles to that other place to get this done by that lady, as opposed to going across town 2 miles and dealing with this psychopath. I can't stand her. Oh my God, I can't fucking stand her. Anywho, yeah. I even told the nurse yesterday, I do not fucking like her. So today I'm canceling that appointment. It's like, no, I don't want her near me. She doesn't want to do what I asked. She doesn't want to refer me to what I asked. She referred me to the chiropractic based upon back pain that wasn't even associated with the areas of concern. Right? She didn't assess the back pain as to where it was. All she did was take what I told her. She didn't look. She didn't have me do any kind of mobility. So she just went with it and referred me to an element of care that I already have, like an open door. I don't need a referral. It's part of my disability. I can call whenever I want. If I need, therapy for my head because I'm depressed and going through crazy shit, trying to get appointments is almost impossible. That's why I use BetterHelp and outside resources. But I can just call them. If I need a prescription for my head, there's no argument there. They'll whip out the pen and hand me something that'll put me under. No questions asked. But trying to get them to assess something of a concern based upon the trauma that I had gone through, which, if you look into it, it is vital. I got a video, I tagged it to some of the other videos of a man who was talking about a man who emotionally and psychologically abused his wife so badly that she ended up with a fucking brain tumor. And it wasn't disclosed until after her death, many years later, that the kids had discussed this whole nature of the situation and said, no, he was just horrifying, mean Christian man. mean to his family. The kids like escaped. It was like as soon as they were old enough to get out on their own, they were running. It's heartbreaking how ignorant the general practitioners can be. They get their credentials, they get their their authorizations for prescriptions and whatnot, but they don't study outside the box. They don't adventure, most of them. There's a lot of them on YouTube who have ventured outside the box. Like Dr. Barry, his wife Nisha, they're very popular on here. She had Hashimoto's, but she kept going undiagnosed for like ages until he stepped in, looked at her blood work, and was like, no, they didn't test this. There it is, right there. So they do the panel, but they don't do the TPO. The other thing that's really weird about PCs is that they don't like to check, and it's really weird that they don't check it. Women especially. And this is kind of like a women's health kind of thing. Women have a tendency to have higher levels of cholesterol than men because we have a lot more hormones. Our bodies run on a lot more hormones than men do. Okay. And cholesterol is kind of a requirement in order to make said hormones. Okay? It's part of the metabolic process. It's, the biochem. Okay? And the other thing that women have a tendency to have is thyroid issues. Now, you got to understand that the thyroid and the metabolic system, which is the endocrine system, okay? And that hormone system, which is the endocrine system. They all work together, so the cholesterol is feeding the endocrine system. Well, when I got my blood work, and I'm giving me as an example, my cholesterol went, way up. And I was like, whoa. And that's what signaled to me, hey, we need to do a full thyroid panel. And we also need to do an adrenal panel to see what it is that's going on and the levels of my cortisol and all the, different alternate, like the adrenaline. There's a bunch of them, but they just call it a generic adrenaline. There's a bunch of little ones that kind of, fall under that title. How this is responding. Because I was struggling with weight control. It is like, and then I started to do a little bit of investigation. Now, the adrenals do get compromised with abuse because your cortisol and your adrenaline are fighting for real estate. And you can put them into a state of fatigue, which that's a good subject. Dr. Berg, if you need consultation on that one, he goes through the whole thing, right? Dr. Barry deals with kind of like thyroid and generic metabolism as opposed to, other issues. Now, Dr. Berg deals with cardiology kind of issues, preventive internal medicine type of stuff. So if you're looking for a specific issue, these are kind of resources you might want to look at if you're not aware of them already. But the point is that this PC's overstepping her purview in response to the fact that I have a GYN and I don't need this PC to be stepping on my GYN's toes. I want to deal with this GYN because, one, of my age. Two, I've already seen her. She knows who I am. And I'm comfortable with her. So it's kind of like, don't be pushing my GYN aside. That's her job. PAPs are her. Women's health is her. That's her specialty. So, with that being said, this is kind of these are the discrepancies, that I kind of read into, and I'm like, this doesn't even make any sense. I went ahead and scheduled the time off from work. I can always call them to recoup it. And I confirmed the appointment, but now I think I'm going to go cancel it. Because it just, I had to mull it over. It was kind of like a shot in the dark because I thought it was a follow up. I did not realize I was going to be this one woman that I cannot stand, that is, won't do anything that I ask of her. So, to follow up with the back pain thing, so it was centralized around my kidneys, and what it turned out is I have those urine tests. I did a video on this. I explained everything. So if you missed that one, look down there. Cured my UTI or my kidney shit with over the counter product. Yeah, that it was all around that. So yeah, it was like 2 weeks after I left her. It was like a week after I received these test strips, and basically I got them just to check my ketone level. And all these other tabs started lighting up. What the fuck? So then it was a couple weeks later, and I was like, okay, I have a UTI that I didn't know I had, or I had a kidney infection, and that's what the pain was. Because the leukocytes were like, whoo, and I was like, this is bad, right? I'm not going back to this bitch. She didn't even do a urinalysis when I was there 2 weeks before. She didn't do a sample and check anything. And the blood work that she had submitted, for me to have done, tested, whatever, was like a quarter of what I'm used to getting. It's like they did 4 vials as opposed to 12. Yeah, because I'm old. I've had great doctors. The one I had telehealth during COVID, he was fucking awesome. The one I had in Cookville, fucking awesome. Everything else, except for the GYN, who's a specialty, she's fucking awesome. Everything else that I've dealt with, no, I won't dismiss my dermatologist either. He was pretty good too. But all the rest of the regular, yeah, struggle is real. So, y'all have a great Tuesday. I'm off because we had downpouring rain. So here I am. Yak, yak, yak. And yeah, I can move around. I think I'm going to go through a couple of boxes and get some stuff, pack up some stuff and unpack some stuff. Try to kind of prioritize, But yeah, that's a video for another day. Why do narcissistic abuse victims have crazy clutter? Yeah, go look it up. Yeah, I'm living proof. Yes, it is real. Yeah, try to hold it all down. Eat, sleep, and work. That's our goal. Maintain our own independent and autonomy. That's it. Everything else, keep our health in check. You know what? The clutter ain't going anywhere. But if I don't keep myself healthy or I don't get myself healthy, it's never going to get picked up. And it may take a long time to fix this shit, but it will get done eventually. Carry on, y'all. Peace. Thank you for watching. Have a great Tuesday.